Knee intraosseous bioplasty is essentially for stress fractures. It's essentially a procedure that's relatively new. The acronym is IOBP, and what it is essentially a way to take care of bone bruises. Bone bruises are essentially an area in the knee that either from arthritis or from an actual injury, such as a stress fracture, the bone actually becomes very inflamed and it becomes very painful. We see this in populations, patient population anywhere between the mid-40s and above. The way we make the diagnosis is usually by an MRI, which is, a test that we do to look at the image the knee itself. The actual procedure is an outpatient procedure. It's done at our local hospital here at Riverside Walter Reed Hospital. The patient will come in and they go home the same day. We offer it to the patients if they want it when we go in and we take care of a meniscal tear, or sometimes they may have a lot of inflammation in the bone from the arthritis, and they tried everything else and they still don't want a knee replacement, and sometimes we may offer them this in addition with a cleanup with the arthroscopic procedure that we do for like the meniscal tears. After the patient goes home that same day, the patient will be set up for physical therapy. This will be outpatient physical therapy. Most of the time they're already putting weight on the knee or the leg the same day. They may need some crutches for a couple of days for balance. They're able to flex and extend their knee freely. There's no restrictions when it comes to that. They'll have an ace bandage, which they'll take off in about a week to minimize the swelling. They'll have a machine to cool the knee down, to an ice machine essentially. We see them back in the office at 2 weeks. At that time we'll remove the stitches. If there were any outside stitches, we'll take them off in the office, and they'll be set up for physical therapy at that time. Physical therapy usually goes on for about a month or two. Most of the time, most of these patients are recovered fully in about a month and a half to 2 months. Outcomes from this procedure are quite good. So far, the studies are showing that the patients have pretty good pain relief. Not every patient that has arthritis will have a bone bruise. So you have to differentiate between those patients and the ones that have the bone bruise. But the ones that have the bone bruise and are good candidates for this tend to do fairly well.